Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about halo sign in ENT. Now there are two halo signs in ENT. One is related to the ear and one is related to the nose. We'll talk about both of them. What is this sign? Where do you see it? What is the reason behind it? Why is this name given? And maybe we'll also discuss a few Viva questions or MCQs related to both of these halo signs. You can also now purchase my notes. I have added links in the description. Okay, so let's get started. So first let's talk about what is halo sign related to the nose. Now as you can see over here, we all are familiar with this sign. This is what we perform the test on a filter paper. So this halo sign related to the nose, this one is actually a clinical sign that we see bedside in a case where we are suspecting a CSF leak. What is this sign exactly? If we had to describe this, if you look at the image, we can describe it as a double ring appearance on a filter paper when CSF is mixed with blood. Now this is what halo sign is. This sign itself has two other names. One is, it is also known as a target sign. As you can see, this image looks like as if there's a target sign. And second, this is also known as double ring sign. You can see that there are two rings forming over here, and that is why this is also known as double ring sign. Now where do we see this halo sign? We see it in cases of CSF leak like CSF rhinorrhea. What happens here? Like, how do we do this test? So in a case of suspected CSF leak, we'll drop the nasal discharge on a filter paper. Now when this nasal discharge is a mix of CSF and blood, it is absorbed onto the paper, and then it separates out into a central dark area and then an outer clear ring of CSF. This central dark area that you are seeing is actually the blood which is concentrating over there, and this outer clear ring that we are seeing, this is formed by the cerebrospinal fluid or the CSF. This is giving a double ring appearance over here. Why does this happen? What is the mechanism behind it? This is happening because when CSF and blood, they are mixed and they are dropped onto a filter paper, both CSF and blood, they have different viscosity. So CSF has a lower viscosity and it is able to diffuse further than the blood. That is why the CSF ends up forming the outer ring, and the blood, which is more viscous and it is not able to diffuse as far, ends up forming the central dark blood spot. This is the halo sign, and we are calling this halo sign, target sign, or the double ring sign because of the central spot and a surrounding clear ring. It looks like a halo or almost like a bullseye target. So this is about the halo sign in the nose. Now let's talk about some Viva questions related to this. What is the most common cause of CSF leak? It can happen after a basilar skull fracture after a head trauma. Next is what is a gold standard test to confirm this finding, to confirm that this is indeed a CSF leak. This is definitely pointing, this filter paper sign, this is definitely pointing us towards this being a CSF leak. But the gold standard test to confirm that this is CSF would be to do a beta-2 transferrin test. And a very common complication which is associated with untreated CSF leaks is meningitis. While we are talking about trauma and basilar skull fractures, there are some other fracture signs that you should keep in mind in case a patient after trauma has come to you with this CSF leak. These signs are, one is battle sign. Battle sign is what you see in a middle cranial fossa fracture. And second is raccoon eyes sign. And this is what you see in an anterior cranial fossa fracture. I'll talk about these signs in a separate video. You can check it out over there. But just to remember, halo sign performed on a filter paper in a case of suspected CSF leak is what we are discussing here. And to confirm that this is CSF, we have to do the gold standard test, which is test for beta-2 transferrin. Halo sign is only suggestive of CSF leak and it does not confirm CSF leak. So that's about the halo sign in nose. Now let's talk about what is the halo sign in relation to the ear. Now, as you can see over here, this halo sign is actually a radiological sign that we are seeing on an CT scan of the temporal bone. Now, what is this sign? If you look at the pointed arrow over here, we can see a radiolucent ring surrounding the cochlea, and this happens because of the demineralization of the otic capsule. You can see that this gives a very double ring like appearance, like a halo around the cochlea. That is why this is known as the halo sign, and the second name is also double ring sign. And where do we see it? We see this condition in cochlear otosclerosis. This is a typical feature that we'll see in the radiology of cochlear otosclerosis. Now, how does this happen? Why are we seeing this halo sign? So basically, around the basal turn of the cochlea, we are able to see this very low density zone, this hypodense area. If you look at this, this is the hypodense area. This is what is giving this a halo appearance. This is basically suggesting that there is inner ear involvement in this case of otosclerosis, and that suggests that there is a sensory neural component involved here. So this is known as the halo sign because of the demineralization of the otic capsule, which gives this radiolucent halo-like outline around the cochlea. Now, some things that you need to know is, first of all, yes, we are seeing this on a CT scan of the temporal bone, but which section will we see it in? We can see this on an axial cut of the CT temporal bone. Next, a few questions related to otosclerosis. What is the most common bone affected in otosclerosis? We all know this, that is stapes. What is the most common site affected in otosclerosis? This is a very important viva question. It is fistula antefenestrum. Then some audiological signs that you need to look out for in otosclerosis is when you perform a pure tone audiogram, we will see the Carhart's notch. When you perform the tympanogram, we will see the type AS curve. And second is stapedial reflex will be absent. So these are some audiological findings that you will be seeing in case of otosclerosis. I have a separate video where I've talked about the different signs in otosclerosis. You can check it out over there. And lastly, can you tell me what is the most common type of hearing loss that you see in otosclerosis? That is bilateral conductive hearing loss, which is progressive in nature. So that's about the halo sign. So let's try to recap this. If you see halo sign on filter paper, we will think about a suspected CSF leak. If we see halo sign on a CT scan of the temporal bone, in that case, we will think about cochlear otosclerosis. So that's all about halo sign in ENT. If you have any doubts regarding this, please note them down in the comment section and I'll get back to you. Thank you.